Throughout the world, women have disproportionately borne the impact of HIV as caregivers and recipients of care. In sub-Saharan Africa, the region with the greatest number of people living with HIV, 60% of people living with HIV are women. You're watching The Last Mile with NACA, and I am Adesu Welsi. Welcome. Today's episode focuses on the importance of women to the national HIV response and the role they play in the fight to end AIDS by the year 2030. Stay with us.
In nearly all countries in sub-Saharan Africa and certain Caribbean countries, the majority of people living with HIV are women, especially girls and women aged 15 to 24 years. On the other hand, women account for 2/3 of all caregivers for people living with HIV in Africa. This goes to show the importance of women to the HIV response. In fact, the UNAIDS emphasizes that meeting the HIV needs of women and girls, as well as zero tolerance for gender-based violence, are essential to halting and reversing the spread of HIV, thus contributing to the achievement of the epidemic control by 2030. Violence, poverty, inequality and discrimination are major drivers of HIV among women.
HIV and human rights, these are very related issues that we need to raise awareness. We have to eliminate gender-based violence for us to actually end HIV transmission, control epidemic, because we see, especially within the time of lockdown, a lot of women were abused. Even we have young girls, sexual abuse, like I already established this. There's strong relationship with the transmission of the virus. So they are very related, and that's why we're raising awareness that everyone must come out to work at ending violence, any form of violence, particularly gender-based violence.
Poverty, HIV, disempowerment, it's a vicious circle. So working with Ministry of Women Affairs, to come up with schemes for empowering, but not just that, but also a social reorientation, we call it a re-engineering of our customs, of our societal beliefs and values.
Studies show that fear of a partner's or relative's negative reaction, including abandonment, violence, rejection, loss of economic support, and accusations of infidelity, were the most commonly reported barriers to HIV testing and disclosure of HIV status.
Particularly in situation of what we call vertical transmission of HIV, where it's the woman who goes to the hospital, get tested, and is first known. It's not that you don't know who. Of course, she probably gets it from someone, maybe the spouse or the partner. And you see the woman, because she's the one that is tested and positive, becomes the carrier, becomes the person that has brought the virus and disease to the family and is maltreated. So for that reason, so many people are positive. One, they might not want to do the HIV test. They also might not want to tell people and prevent transmission to other people.
It is proven that strengthening women and girls' education is directly linked to effective HIV prevention. Yet, women know less than men about how HIV and AIDS is transmitted and how to prevent infection.
HIV is beyond health. So it is education. We need to work with the education people to ensure that when you keep girls in school, then it reduces the issues of child marriage, and then also it reduces the circle of poverty, because if she goes to school, then she's empowered, and then there's the power dynamics. If a girl or a young woman is not educated, then she's at the beck and call of some men, and therefore she can be abused, sexually abused, and she can have a lot of emotional insecurity and trauma, and that's a lack of self-esteem, lack of agency, no self-autonomy and all that. So, and that perpetuates the infections, the circle of infections.
Mother-to-child transmission, MTCT, is the primary cause of all HIV infections in children under 15. However, the coverage of HIV testing during pregnancy is low.
Despite the fact that we've made significant progress in terms of reducing the prevalence rate of HIV in Nigeria, today 1 out of every 7 children born HIV positive in the world is born in Nigeria. Why is that so? We feel that this is a space that has significant shortfalls in terms of program funding. We believe that part of the challenge is because barely over 60% of Nigerian women give birth in regular hospitals and primary health care centers where HIV screening is mandatory. So you have another section of Nigerian pregnant women who give birth through traditional birth attendants and other platforms. So these are some of the places where we have the leakages. And then we have the issue of test kits, even in some of the primary care centers. So the analogy is like you are playing a football match, you have top strikers and scoring goals, making progress on the identification of people living with HIV, on reducing prevalence rates. But every year, they are scoring more goals because you don't have a goalkeeper. Because every year, we have about 22,000 children born HIV positive in Nigeria, every single year. So if you say that you have 1.9 million people living with HIV, and every year you're adding another 22,000, then you have a problem.
Every pregnant woman that comes to a facility and accepts HIV testing and is found to be HIV positive, we have 100% success of protecting the baby, preventing mother-to-child transmission of HIV. We are 100% in terms of our success. However, for pregnant women that don't show up at the facilities for delivery, at facilities for antenatal care services, our access to them is limited. What we are doing now is to map out locations where the services are given all over the country. After this mapping, we'll now be able to spread out the services more and go into the community. This strategy that we're about to adopt will give us access to more pregnant women, because now we are going to the community level, the household, whatever is convenient for pregnant women to be tested. We want to make sure we test as many pregnant women as possible this year.
ASWAN is an association of women living with HIV and also women advocates who are fighting HIV, mitigating the impact of HIV. ASWAN women are also mentor mothers in the facility, and these mentor mothers are ASWAN members who are stationed in every federal government facility, state government facility, and also local government facility to provide them counseling services at the antenatal clinic and also HIV treatment center for women, pregnant women who come in for antenatal, ensuring elimination of mother-to-child transmission, moving from elimination of mother-to-child transmission to eradication of mother-to-child transmission of HIV, and keeping women alive, because it is important that women are available to take care of their children.
Failure to address the needs of women and girls living with and without HIV in a holistic, comprehensive, coordinated and monitored manner could prove detrimental. The global, regional and national health community will continue to be challenged in successfully accomplishing the overall mandate of reducing new HIV infections, HIV-related stigma and discrimination by 2030.
HIV has affected or is affecting female greatly compared to men. And this has to do with so many things. Inequality is one of it. The fact that you are the people that make yourself available for testing. The fact that you access services more than us, is bringing out the good in you in terms of caring. You understand? Mothers care for their children, mothers care for their household, mothers care for the community, and mothers care for country. And because of that, because of your sacrifices, Because of your ability to come forward to accept and HIV testing and know your status, today we're able to identify most of you that have HIV in them and place them on treatment. What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it. Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
The update segment brings you a highlight of NACA's activities across the country and elsewhere. Don't go away.
The Network of People Living with HIV and AIDS in Nigeria, NEF1, recently organized a one-day advocacy engagement on its Advanced HIV Disease Project. The project aims to raise awareness and advocate for the availability and procurement of CD4 machines and regions at various healthcare facilities in Nigeria. The National Coordinator of NEF1, Abdul Qadir Ibrahim, shed more light on the purpose of the event.
This event is all about creating awareness to general public, especially stakeholders working in the field of HIV, our implementing partners, and the community of people living with HIV to know that advanced HIV disease is here and is receiving minimal attention. And people need to know the danger around it, because when you are on treatment and you are enrolled in care and your CD4 count is less than 200, it's showing that you are not really doing well on treatment, and the risk of reaching to AIDS or even dying is on the high side. And we are worried about that, and we are much interested in creating that awareness, and of course to also increase demand creation on other opportunistic infection that might likely affect people living with HIV, such as TB, and the TB screening among the patient community is quite low. So we just want to begin to talk about it and sensitize people about the risks and the need to accelerate some of this, and to also demand for these services, and to also call on the government to really step up and ensure that reagents are available and also machines for these investigations are procured and readily available for usage for the poor indigent patient who access treatment across the country.
Goodwill messages were delivered by some stakeholders present.
Nigeria has an estimated 1.9 million PL-HIV with over 1.8 currently on ART. And out of this, we had 32% of them with CD4 counts less than 200 in 2018. And then in 2020, we had 21% of PL-HIV with less than 200 CD4 counts. And this and other emerging evidence on AHD necessitated the development of a package of care to promptly identify and manage AHD. Now, the AHD package of care is being implemented in phases, and the first phase of the implementation is in 28 facilities in 4 states, including Lagos, Akwa Ibom, Rivers, and Anambra states. Now, based on the lessons learned from this first phase implementation, NACA is scaling up the implementation of the AHD package of care to other health facilities and in all the states of Nigeria. In order to ensure success and sustainability of the AHD implementation across the states, there is therefore an urgent need to involve the patient community in case identification and management of these cases across the country. Now, I therefore wish to congratulate the NEP1 for initiating this AHD 8 project and pushing for health facilities to have CD4 machines and reagents. And as a stakeholder of HIV control in Nigeria, we are glad to offer our technical expertise to mobilize the stakeholders to key into this laudable project embarked by NEP1 towards ensuring that all AHD patients are identified and properly managed.
We are here today because of the advanced HIV disease. And one of the things we've seen in the AIDS response, more and more people being on treatment, has been the reduction of AIDS-related mortality and morbidity. So those with less than 200 CD4 count shouldn't be left behind. There's evidence from NACA that when you are on treatment early enough, it reduces, so the mortality and then the morbidity related to HIV and AIDS. Advanced stage means you have less than 200 CD4 count. And we know that they are at higher risk of dying, of HIV and AIDS. And nobody with what we have now should be dying, so because of HIV and AIDS. So they are at risk because they are vulnerable to tuberculosis. They are at risk because they are vulnerable to bacterial infections. But they are also at risk because of cryptococcal meningitis. So that's what really put them, so at risk. So we will do everything possible to support this project, to advocate for this project, to ensure that resources are mobilized, to create awareness, to ensure that facilities have access, so to the testing, and making sure that you also have access to those treatment. Treatment can be expensive, and it's part of the package. And I look forward, so to working very closely with you.
The engagement featured a presentation of the advocacy roadmap to all stakeholders for their support for the project's success. Some participants shared their thoughts.
AHD defined as people with CD4 cell count less than 200 cells per millimeter cube. That's in adult or adolescent or people with WHO stage 3 or 4. But children less than 5 years are considered to have advanced HIV disease. For us at NACA, as we move towards achieving epidemic control, it's also important for us to reduce, mortality, AIDS-related mortality, and this is very critical, in identifying those with AHD. So yes, this meeting is very important. More importantly is to ensure sustainability of the program and access to treatment.
UNAIDS is very happy to be part of this advocacy workshop on advanced HIV disease. In 2020, about 20% of AIDS patients in Nigeria who were newly enrolled on treatment had less than 200 CD4 per cubic millimeters. And that's how we defined advanced HIV disease. So having an advanced HIV disease puts you more at risk even when you start the treatment. It puts you at risk, of dying, because you are vulnerable to tuberculosis, you are vulnerable to bacterial infections. You are also vulnerable to cryptococcal meningitis. So it is important that we do everything possible to make sure that we create awareness around advanced HIV diseases.
The event was highly interactive as participants asked salient questions and made suggestions for the way forward.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
This HIV test kit na ogbonge test kit wey WHO, Federal Ministry of Health and NACA don confirm. If you go like know more about the test kit, make you call NACA Information Center on top 6222 free of charge. Make you no eat, drink or use anything wey dey take clean mouth 30 minutes before the test. Oya make you look for somewhere where be say na only you go dey there wey get better light and flat top. When you open the test kit, you go see paper wey explain how you go take do the test. Read am well so that you go fit understand am. You go still see test stand and another package where be say e get test device, plus including test tube and something where be say dem put am so that the package no go spoil, but you no go need that one for the test. Oya open the tube, then put am on top the test stand. Now make you carry the test device, but make sure say you no touch the flat side. Oya open your mouth, then rub the flat side of the test device one time on top your gum wey dey up and one time for the gum wey dey down. Now quick make you put the device inside the tube. Leave am there for 20 minutes before you read the result. Make you no read the result after 40 minutes. Now if one line show on top letter C and letter T, then the test na positive and you go need to contact NACA for advice on wetin to do next. If only one line show on top letter C, then the test na negative. The test no follow at all if no line show or only one line show on top letter T or the background wey be white before come change to red. You go need to do the test again. When you finish, pack everything wey you take do the test, put for inside dustbin. Make we support NACA to fight HIV. Know your HIV status today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week, on The Last Mile with NACA, I am Adesuwasi. Goodbye.